So thank you, Dr. Watza, for being our first doctor to be featured in our Is There a Doctor in the House series. I would like to take the first 2 minutes for you to give a brief introduction of yourself, how long you've been working for CareSTL Health Center, and a brief description of what you do here.
Yeah, so Courtney Watza, I'm a pediatrician, general pediatrician. So I take care of kids, well visits and acute visits and just their general care. I have been at CareSTL Health for about 2 years now, a little over 2 years. I trained in Michigan that's where I'm from. I trained in Detroit, Michigan for my med school and my residency, and I did a year-long academic fellowship there too, and then came here to St. Louis with my husband for his fellowship and have been at CareSTL Health for 2 years.
Great. Well, thank you so much. We do appreciate all the hard work that you do here for us. All right, so as you know that April is Autistic Awareness Month. We are, for our diversity and equity and inclusion initiative, we are featuring you to give us some insight on autistic individuals. So in this series, I'll be asking you about 5 questions, and you will just give us some of your education and insight on it.
Sounds good.
All right, so first question, what is autism?
Yeah, so autism, at its basis, it's a neurodevelopmental disorder. So it affects basically how somebody's brain functions. You'll hear a lot of terms, particularly from people with autism, that say things like neurotypical. That means somebody who doesn't have autism, whose brain is functioning as we would say typically, right? And then neurodivergent. And a lot of time that covers not just people with autism, but also just anybody whose brain kind of works differently than what we consider normal, which is a term I don't always like to use because everybody's brain works differently, but what that we typically think of as a typically neurodeveloping person. And then you'll also hear sometimes people want to be called autistic, sometimes they want to be called somebody with autism, and that is really case by case basis. But autism itself is a neurodevelopmental disorder. It affects mainly interactions, like social interactions and how somebody interacts with another person and relationships, as well as communication. So a lot of times you'll see that present as like a speech delay. Sometimes it might not present as a speech delay, but they just have difficulty in conversations and picking up certain cues in their communication. And those are usually the two big areas that it covers. You often usually see like repetitive behaviors too. So sometimes like you'll hear the word stereotypies, and sometimes it's things like flapping their hands, spinning in circles, different things that kind of helps them calm down when they feel overstimulated. You will also see that they might have restricted interests. And those can be all sorts of things. And not everybody with autism will have them, but sometimes they'll want to focus on one particular thing. It can be animals, trains, cars, all sorts of things, but they tend to really focus a lot of stuff on that. And that can come up in a lot of different ways. So you can see that sometimes. So the big thing is that developmental disorder that affects communication though and social interaction, but then it also has to affect their life, just like any sort of disorder in development or a psych disorder. Usually to actually be a disorder, it has to affect their daily life and their functioning in their daily life. The other big thing to note with autism is there's a lot of things that can look like autism spectrum disorder. So just a global developmental delay. There are genetic disorders. So in order to get a diagnosis of autism, you can't have another diagnosis that better explains the symptoms the person is having. And then on top of that too, it is a spectrum. So a lot of times you'll hear us call it like autism spectrum disorder. They used to also have the term Asperger's, and sometimes people will call themselves Aspies. So if you ever hear that term, that's what they're referring to, an Asperger's diagnosis. We don't diagnose that anymore. Basically, Asperger's was the higher functioning people with autism spectrum disorder. And so it used to be called Asperger's. If somebody already has a diagnosis with Asperger's, we don't take it away, but we don't give that diagnosis anymore. It's all just autism spectrum disorder and where they fall on this spectrum. And I usually educate families and parents about that too when we're talking about autism spectrum disorder, that the development level your child will reach kind of depends on them, and we'll just do whatever we can to get them to reach their full potential and meet them where they're at, with kind of how their brain functions a little differently. So that's kind of a broad sense what autism spectrum disorder
Thank you for that. The
is.
sec- Thank you. The second question is, you mentioned some of those identifying behaviors of individuals that may have a diagnosis of ASD. Um, how early can you see those kind of behaviors?
Yeah, so you can see them pretty early. It just depends. The A lot of the times, right, these things, because it is a disorder of interaction with other people in relationships as well as speech. Most of the time you're catching these is the earliest is usually going to be about toddlerhood range. And that's because developmentally, we're expecting them to start speaking. We're expecting them to start interacting a little bit more, and having some like relationship building at that point. For the developmental level as a toddler. So you'll see that a lot. And that's usually the earliest that we'll start talking about a full diagnosis of autism spectrum disorder. Sometimes there's like early signs where we say, like, if a baby doesn't have a social smile by 6 months of age, it might be an indicator of autism spectrum disorder. But that by itself is not going to get us to say we need to diagnose this baby with autism spectrum disorder. And the stuff they do to diagnose this is really not possible until they're at least a toddler. And then you'll also look for, those interactions, things like they might have poor eye contact is a big one. And it might not mean that they don't ever make eye contact, but it might be really brief and they feel very uncomfortable sometimes with like a longer eye contact, that you might see with other neurotypical developing toddlers and kids. And then we talked about they often have speech delays. Sometimes severe. That's super varied with the amount of speech delay that they have. Yeah, and another big thing to notice too when you're looking at some of those identifying behaviors is sensory issues. So you see sensory issues a lot with kids with autism spectrum disorder. A lot of time it comes out with parents with picky eating. And of course, like, kids have picky eating, a lot of kids do, and that doesn't necessarily equal autism spectrum disorder. But if I have a parent or a child coming in telling me they have all these, some concerns with speech and concerns with their interactions with other kids or with family members, and they also have picky eating, that definitely makes me more concerned. You might also see it with like clothes, like they don't like tags a lot on their clothes, or they might be very picky about like, oh, they'll only wear like cotton or certain things because that can really bother them as well. So you'll see a lot of sensory issues with it as well.
Very interesting. Can you provide some tips on how to interact with individuals that has ASD?
Yeah, of course. So definitely some of the broad things to think about are, remember that like it's a spectrum. So some might be really functional and they can have a full conversation. It might just be their comfort and ability to pick up on social cues that might be an issue for them. So with that patient, you'd probably just, talk to them normally. They've got their speech, they're functioning, other than they might need some help with social cues. So you might have to be a little bit more blunt sometimes with them and saying exactly what you need. You might also have to be more literal. A lot of times kids with autism and people with autism spectrum disorder need a little bit more, they don't understand like nuances sometimes of language and social interaction. So being more literal about what you're saying can be very helpful as well. And then from there, if they are on the spectrum and they have some more challenges that they deal with, so say it's somebody who doesn't have full speech, or some of these kids and adults don't speak at all ever. And so just being able to communicate in other ways with them, and not always relying on just what they tell us speech-wise can be really helpful. In peds, we're used to that. We see a lot of kids that can't tell us what they're feeling. So we're used to picking up on those cues, but definitely paying attention to, physical cues they might be experiencing to tell you what's going on. And usually their caregivers are really in tune to how they express their feelings and emotions. That can be helpful.
Thank you. So, who are at risk for autism?
Yeah, so really anybody can get autism spectrum disorder. You do sometimes see it run in families. Um, we know that there is a genetic component, but it is not like some other genetic disorders where we can say this is exactly what the diagnosis is. This is the genetic test we do. And if you have it, you have it. If you don't, you don't. It's a lot more complicated than that. They'll do sometimes like whole exome sequencing, microarrays, and they'll look for different, there's some associated like microdeletions that we see commonly among people with autism spectrum disorder. So there is definitely a genetic component. We don't think it's all genetic based. But if you do have a family with like a lot of family members with autism spectrum disorder, you might be more apt to say that's what could be going on. But with that in mind, also remember that things like intellectual disability tend to run in families. So keep an open mind of, is this autism spectrum disorder running in the family, or could it be something else that could also have a genetic link and tends to run in families? Other than that, we don't really know if they're going to get autism spectrum disorder until they are old enough to need to do those things that they are, those like milestones they're not reaching that we would expect them to. So we kind of just have to give it time to see if they develop. From there, one thing I do want to mention is there's a lot of false data out there about vaccines and vaccines relationship to autism spectrum disorder and causing autism spectrum disorder. That has been disproven. There is no link between vaccines and autism spectrum disorder. That came from a paper a long time ago from some, I don't remember where he was, but a doctor who looked at the MMR vaccine. But we found out a lot of his data was falsified. He's no longer practicing. And there have since been studies that show there is no link between the two. And part of it is we give a lot of vaccines, right? That MMR, we give it at 1 year old. And at 4 years old, and those are the prime ages that we're diagnosing autism spectrum disorder just because of their development.
Thank you. So you mentioned just kind of waiting to see how a child develops. What are some benefits of early diagnosis of ASD?
Yeah, so early diagnosis, really of anything that they're going to need therapies for is going to be the best. We know the earlier we intervene with kids and provide them therapies to reach their full potential, the better they do long term. Plus, if we can get it done before they get into school, then when they get into school, we've got some of that stuff already in place so they're not falling behind in school. And then, you're already in a catch up game. At that point. So to get them ahead is definitely helpful. One of the early things we do for a screener, so for all kids, even if we don't have any concerns, we do something called the MChat. There are other validated screeners. That's really the most common one. Pretty much everyone uses that one. And so the MChat is, I think it's 20 questions, but they're just yes and no questions. It's things like, does your child point with one finger to things they're interested in? Do they hold your eye contact for more than a couple seconds? Do they like movement activities? Are they afraid of everyday sounds? Things like the vacuum cleaner, which on a note of that one, a lot of kids are afraid of the vacuum cleaner sound. That doesn't necessarily mean they have autism spectrum disorder, but it is something along with other things that can help lead you to that diagnosis. So we do the MChat with every child at a well visit at 18 months old and at 2 years old. And then depending on the results of that tells us how high risk they are for autism and what our concerns are. So if that score is less than 2, we say there is a low risk for autism spectrum disorder. And unless there's another concern from the parents or you for another reason, we don't need to do anything further for that. If it is over 8, then that is a high risk for autism spectrum disorder. And we usually refer right away for therapies. If it is between 3 to 7, I believe 8 does count as high risk, but if it is 3 to 7, we consider that medium risk. And then there's follow-up questions that you can find online usually that you ask to kind of, and they basically just ask the same questions, but with different wording. So you can figure out if that's really a concern for this child, or if different wording, the parent doesn't have a concern. So that's one of the early screeners we do to try and get it even before you might see the social issues, because you might not see those until a kid is in school or daycare, and not all kids go to daycare. So definitely doing that. But with that, so I talked about a lot of these kids have communication and speech delays, and so getting them an early speech therapy is definitely very helpful. Some of them also need like physical therapy, occupational therapy. We usually do a hearing screen for these kids as well, just because any kid with a speech delay, you want to make sure there's not a hearing issue that is causing part of that speech delay. The thing to note about autism spectrum disorder, so it's a complicated diagnosis that we do not diagnose as pediatricians. It has to come from a specific autism specialist. Sometimes that's neurology. A lot of times the best diagnoses come from these like multidisciplinary clinics. They are in high demand, and they are long appointments to really get in with these kids about, what issues they're having that work with them. So it is a long wait list to get into a lot of those. So I usually counsel the families at least a year, sometimes more. I know one of the ones we refer to a lot is 18-month waiting list right now to even get an appointment. So it is a long waiting list to get that appointment. And these multidisciplinary centers basically have multiple different specialists that come in that evaluate these kids and see if they meet a diagnosis of autism spectrum disorder. And while we're waiting for that, we do get them into whatever other therapies they need, like I said, speech, OT, PT, if they need an audiology exam to do that as well. And the earlier, like I said before, with any of these delays, the earlier we start treatment, the better they do long term. So that's definitely something that's important for us. The other things are just once you get a kiddo is in school, things like talking to them about an IEP, and if you have to write a letter for an IEP, which is basically just a letter that says they have this diagnosis, so that they can get extra support that they might need in school. Sometimes it is those speech therapies through school. Sometimes if they're overstimulated, it might be time away from the class if they need time to get away from some of that stimulation, because a lot of these kiddos can get overstimulated by all sorts of things, noises, lights. So being able to step away from that. And then it basically just gives them some guidelines of how to help this child meet their full potential, because unfortunately our school systems are not set up for every different type of child and how they learn. Another big thing is making sure they have structure, which can be done at home and at school. These kids tend to thrive on schedules, so that's important too. And then there is another thing called ABA therapy. It's applied, I always forget exactly what it's called, applied behavior analysis therapy. It is kind of controversial. Some people let it, some people don't. It is a really intensive therapy that basically takes the place of school for a lot of these kids. It is 8 hours. It tends to be really long, but they'll meet the kiddo wherever they're at. So if it's a kid who's just having trouble with social interaction, they'll meet them there. If it's a kiddo, when I visited one when I was in training, they had a kiddo who had difficulty leaving the house just because like putting on shoes and leaving was really difficult for them. So they actually met them at the house and would work on those things. So they just kind of met them where they were. But then they're not in school doing all the stuff they should be doing in school. So it's a controversial thing, but ABA therapy is something you might hear when people talk about therapies for these kids and for autism.
Thank you, Dr. Watza. I have 3 questions in the additional questions that came across in the chat. The question is, what is the difference between autism and Asperger's disorder?
Yeah, so they are all on the same spectrum. So as I mentioned before, we don't give the diagnosis of Asperger's anymore. It is now all autism spectrum disorder and then just a different functioning level. Asperger's used to be basically your highest functioning kiddos with autism spectrum disorder. Usually those are the ones that tend to be really intelligent, and they have full speech, and they're functioning as you would expect somebody to normally function in terms of not like a significant speech delay, but they have more of those interactions. You see it more when it comes out of their relationships and how they interact with people, and their inability to pick up on certain social cues and different cues in just speech and conversation. So that's the biggest thing. It's basically Asperger's basically is your highest functioning level of autism spectrum disorder is what it comes down to.
How soon can you diagnose autism during pregnancy?
So you can't diagnose it during pregnancy because we don't know until we see if that kiddo is developing the way we expect them to. So the earliest we'll like really refer for diagnosis is going to be in that toddler stage, usually about 2-ish and older. If it's a really extreme case, it might come out earlier. But that's why we're doing that MCHAT at 18 months and 24 months, because that's what the earliest we're really going to start seeing a lot of those typical defining factors of autism come out, and that is because they're developing. And a baby is not expected to have like pick up on social cues and do all of that and speak and be able to interact the way we would expect them to in regards to autism. And so you have to wait until the child is developmentally appropriate, where you would expect them to be speaking and expect them to be able to start picking up on some of those social cues and making eye contact with people. So toddlerhood is the earliest we're going to be diagnosing that.
Yeah. There are several different types of autism. Why do some autistic children show violence, and how do one handle the situations?
Yeah, so that's definitely something that we can see a lot. So it is all that spectrum again, and we talk about that a lot, right? And where they fall on the spectrum is going to be different. We tend to see more of those violent behaviors in kids who have more delays. So some of that just with kids in general, and we see this a lot with young toddlers, is if they don't have the speech to fully express the things they need and the things they want, it might come out in different ways. Other than that, there's not necessarily a good reason of why that tends to happen with certain kiddos. And a lot of times parents are able to deal with it when they're younger because they're smaller, but when they get bigger and this kid might get a little bit more violent when they're larger, that becomes harder for the families to be able to control. I don't personally prescribe any of the medications. Sometimes they'll use certain psych medications, particularly like atypical antipsychotics and stuff like that, that can sometimes show to help some of those behaviors. But that is all going to be done through a psychiatrist that is who we're referring to for that. If they also have, though, a lot of violent behaviors, you can always get them into therapies, because if they can work with them just with therapy, that can be helpful too.
How likely are adults to be diagnosed?
Yeah, so we definitely probably missed, right, a number of them, and they come up. It is hard to diagnose adults because a lot of these centers, right, because we can't just say, oh, you have autism spectrum disorder as a primary care doctor. It has to be done through these specialists. And so you have to be able to find a specialist like one of these centers that will see adult patients. So that's going to be the hardest thing. The good news is, right, for the most part, it can be important for somebody to know that they have autism spectrum disorder just for their own like understanding why they might function differently than other people. But not having a diagnosis doesn't stop us from getting them any of the therapies that they need. And, you know, helping people learn to adapt to different social situations that they have to adapt to. So it is definitely a hard thing to diagnose when you're older, just because the places that diagnose it don't necessarily see adults. But if we can still help them with whatever difficulties they're having in their functioning of life, then we'll still provide them the same care you would be giving somebody with autism spectrum disorder. They just unfortunately might not get that diagnosis.
It seems like autism is being diagnosed more often from this individual's perspective. Is that because there's more awareness of it, or is it occurring more often for another reason?
Yeah, we see that with a lot of things that we're seeing, like in pediatrics. We see that with ADHD too. And there's not a very clear answer with that. I think awareness definitely has something to do with it, right? If you're thinking about it, then you're going to see it. If you don't think about it, you might miss something. The understanding of what it means has also changed. The ability to do something about it if we diagnose it is also better. So like people are more aware of it in the schools, and getting accommodations for an IEP can be helpful. So for us to actually diagnose that and parents to be on board and wanting to get that diagnosis can sometimes be helpful, and might also make it where parents are more interested in looking into it because we can make more interventions at this point. And then who knows if there's more environmental factors or what's causing another increase, but awareness definitely has something to do with it, I'm sure.
Would you briefly speak on management of patients with this disorder in their adulthood?
Yeah, so I obviously don't take care of adults. So once they're like 18, we're like, they move on to the adult doctors. But with my older, like adolescents and stuff, your biggest things, I mean, it's the same thing. They probably aren't going to need as much of like those speech therapies and stuff, but it can be helpful for them to have a therapist if they're having trouble with social situations. Sometimes a therapist who specializes in those kind of things can help them learn how to approach social situations and start to learn to pick up on some social cues for them. That can definitely be helpful. Other things are just the stuff we talked about when you're interacting with them is being more literal about what you're saying, realizing that like eye contact with people, they might not be giving that to you. And a lot of times we kind of expect eye contact to know somebody's listening to us. And so you might not get that from somebody with autism spectrum disorder, but like any sort of therapy that can help is definitely going to be helpful for them. The other big thing is going to be sometimes you'll have caregivers who might want, stuff signed so that they can have certain rights to make certain decisions for patients based on their ability for their own like activities of daily living and if they can manage their own money and all of that kind of stuff. And that's going to be a case by case basis about where they are on the spectrum and how much they can handle. A lot of these people can function in life just fine, and like it's just a different. I explain it to parents. It's like their brain works a little differently, so we just have to meet them where they are. Unfortunately, society likes one type of the way that brains function, but they can function in all different ways, and most of these people are able to figure it out and learn to kind of function in the society as it is, unfortunately.
Great. We have one more question before we conclude. Are there common dual diagnoses with the ASD?
Yeah, so like a lot of those different things that would be like neurodivergent and stuff too, you see them coincide. So a big one, you'll see ADHD with autism a lot. You can see really a lot of those disorders. It's not like a lot of the bipolar or anything like that show up more with autism spectrum disorder, but ADHD is a really big one. As long as you don't have another diagnosis that explains the symptoms better than autism, that would be your diagnosis instead of autism spectrum disorder, you'll see a lot, but it's not like they're at higher risk for bipolar or anything along those lines. But ADHD is a big one that we see that is people with autism can have ADHD too.
Great. Thank you, Dr. Watson, so much for your sharing your knowledge behind autism awareness. We really appreciate all that you do here for CareSTL Health. Thank you again, and you all have a great day.
Thank you, Dr. Watson. Great job.
Thank you.
Thank you very much. Well
Thank
done.
you.